talking about CAR T cell therapy, it is associated with significant and unique toxicities like cytokine release syndrome and neurotoxicity. Some studies have evaluated patient-reported outcomes, including studies that we have done, which have shown that quality of life of patients dips in the first month or so and then goes back to baseline. And so we conducted this study not only to evaluate patient-reported outcomes, asking patients about their symptoms, and also asking about cognition, which is very important because when neurotoxicity happens, we don't know the long-term impact of that is. Do patients have cognitive impairment a year, 2 years down the line? We don't know that. So we asked them about their cognition, but then we also did an objective measure of cognition using the NIH toolbox, which is an interactive web-based test that takes about 45 minutes where patients are asked questions about memory, calculation, putting things together and so on. And so what we found was in the quality of life and symptom burden, yes, quality of life, again, as expected, goes down in the first 2 weeks, which is accompanied by the peak symptom burden, and then it gradually comes back up. When you ask patients about, do they feel a cognitive deficits in a few weeks to months after CAR T, they didn't report anything. But in this very early data, and this is preliminary data from interim analysis, we found that using the NIH toolbox, there might be a trend towards a slight decline in cognitive ability. It did not meet the clinical significance criteria yet, but the lines were downtrending. So I think this is something we have to look in the future when we complete our study accrual, like, is there really a downtrend in cognition? Because that would be different from what patients are reporting. And maybe patients don't have an insight into that. Or maybe we'll see there's a transient downtrend that improves. So more to come on that, but this is something we'll be watching for very carefully.